Here's a detailed overview of the lumbar vertebrae in terms of their anatomical location, structure, associated features, and more. Anatomy of lumbar vertebrae. 1. Anatomical location. The lumbar vertebrae are located in the lower back between the thoracic vertebrae, T12, and the sacrum, S1. There are typically 5 lumbar vertebrae, labeled L1 to L5. They form the posterior part of the abdominal cavity and support the lumbar region of the trunk. 2. General structure. Each lumbar vertebra has these key components. Vertebral body, large, kidney-shaped, and robust to bear weight. Vertebral arch, forms the vertebral foramen, consists of pedicles, connect to body, laminae, connect to spinous process. Spinous process, short, thick, and horizontal for muscle attachment. Transverse processes, long and slender, project laterally for muscle attachment. Superior and inferior articular processes facilitate articulation with adjacent vertebrae. Vertebral foramen, triangular in shape, through which the spinal cord passes. 3. Associated structures, intervertebral disc, found between adjacent vertebral bodies. Facet joints, zygapophyseal joints, synovial joints between articular processes. Ligaments, anterior and posterior longitudinal ligaments, ligamentum flavum, interspinous and supraspinous ligaments. Muscles, multifidus, erector spinae, quadratus lumborum, psoas major. Spinal cord ends at L1 to L2, conus medullaris, below which is the cauda equina. 4. Gross anatomy of typical lumbar vertebra, e.g. L4. Body, large and oval. Foramen, triangular and large. Spinous process, hatchet-shaped, directed posteriorly. Transverse processes, long and thin. Articular facets, oriented sagittally, limits rotation but allows flexion extension. Mammillary processes, on superior articular processes, attachment sites for muscles like multifidus. 5. Histological structure, compact cortical bone, outer shell of the vertebral body and processes. Trabecular, spongy bone, inside vertebral body, filled with red bone marrow. Cartilage covers articular surfaces, hyaline cartilage. Periosteum, dense fibrous membrane surrounding bone. 6. Blood supply, arterial supply, lumbar arteries, branches of abdominal aorta. Posterior intercostal arteries, lower ones, may also contribute. Small branches enter through nutrient foramina. Venous drainage, lumbar veins, which drain into inferior vena cava, ascending lumbar vein, vertebral venous plexus, important for metastatic spread. 7. Nerve supply, recurrent meningeal nerves from spinal nerves, supply periosteum, ligaments, outer part of intervertebral discs, dorsal rami of spinal nerves, supply associated muscles and skin over the lumbar spine. Lumbar plexus lies anterior to the transverse processes, L1, L4 roots. 8. Lymphatic drainage. Lymph drains into lumbar, lateral aortic lymph nodes, eventually drains to cisterna chyli, then the thoracic duct. 9. Functions. 1. Weight bearing, support the upper body. 2. Mobility, allow flexion, extension, and lateral bending, limited rotation. 3. Protection, enclose and protect the cauda equina. 4. Attachment, serve as origin insertion points for numerous muscles and ligaments. 5. Intervertebral discs distribute mechanical loads.